COVID-19 is ravaging the globe. But what if treatments needed to fight coronavirus were only available to the rich? It doesn't have to be this way. When Jonas Salk, developer of the first polio vaccine, was asked who owned the patent to the world-changing discovery, his answer was simple: the people. But what about treatments for COVID-19? Today, the pharmaceutical industry is one of the most profitable on earth, thanks in large part to the way Big Pharma selfishly guards its patents. Patents amount to legalized monopolies. With no competition, Big Pharma can charge whatever price they want, allowing corporations to essentially hold humanity hostage. This is not a time for profiteering. To fight a global pandemic, we need a global response. One that puts people first. Rather than locking up life-saving health innovations through high prices and monopolies, the world needs open access to all COVID-19 treatments, vaccines and tests. We need world leaders to take concrete actions to ensure this happens. The idea is to create a system to freely share knowledge about all COVID-19 related medical products, fostering cooperation in the face of this pandemic. Sharing know-how and research findings would be a start. We need world leaders to prevent patent monopolies on any new COVID-19 vaccines or treatments so that they are affordable to all countries and free to the public. It would also help to scale up production to deliver the huge quantities the world needs. And we need governments to collaborate globally to ensure Big Pharma supplies vaccines and treatments to developing countries so that no one gets left behind. Billions in taxpayers' money has already been pumped into research for treatments and vaccines. It's only fair that this investment benefits global public health rather than lines the pockets of Big Pharma. Not only will a plan like this save millions of lives across the world, but it will be a compelling demonstration of global solidarity. Since the start of this pandemic, we've seen how powerful it is when ordinary people come together to look after each other. We can build on that power, making sure all COVID-19 treatments are accessible and that people come before patents. These efforts will ensure that no one is left behind in the fight to treat this pandemic and will pave the way for all medicines to be affordable in the future.